So let me just give you an overview of what to expect for the day and then tell you about a few of the special guests that will be joining us to help us along our journey. So the 3 questions I hope you're able to answer by the end of the session. First is why? Why are we here? Why are we doing this work? And what is it all about? So you're going to hear from a wonderful woman who is in the Medicaid program about her experiences and her children's experiences with the Medicaid program. We're excited that Shayla is here with us today to talk about why we're doing this. Second, we have to talk about, well, what are we building, right? We all talk about Medicaid transformation, a lot of stuff's happening, but we all want to get on the same page about, like, what does this exactly mean for us as a team? What do we have to build? What do we have to do differently? Then we'll have a special guest. Because this is such an impactful work for the state of North Carolina, the governor wanted to come by and say thank you. So maybe not the time you want to go to the bathroom if you want to see the governor. And then third, my former boss, Andy Slavitt, who used to run the Centers for Medicare and Medicaid Services when I was there, but also led the turnaround of healthcare.gov. Remember that little crisis thing? So he's run enormous projects in the private sector and the public sector. And so we're going to have, if you notice this little fireplace here, we're going to have a little fireside chat, very Woodrow Wilson of us, to talk about how, right? So we're going to know why we're doing this, who we're focused on, what we're doing together as a team, and then how are we going to get this done together.
When we think about One Medicaid, and here's the way I like to think about it, is that the Medicaid program means something to every one of you in this room, but frankly, to 2 million citizens of North Carolina, it makes a huge difference in their life. What we're doing is doing something for those 2 million people in North Carolina and so many other people that impacts. So it's not just the folks that are on the Medicaid program, but it's millions other North Carolina citizens that are impacted by that. When we think about One Medicaid, I think it's exactly right. It doesn't matter where you sit, whether or not you sit in the Division of Health Benefits or IT, or you sit in public health or mental health. We're all trying to do the same work, and we have this opportunity to do something that is unique in the country and certainly unique for North Carolina. We're trying to improve the health of North Carolinians, not just provide better health care, and we'll talk detail about what that means. But I want to emphasize those 3 big things, right? This is big. This is big. Secretary Cohen said it's one of the biggest changes that we'll have in North Carolina in terms of health care and health. I'm not sure what words you use, but I'll tell you it's decades. I've been in North Carolina for 30 years, and there is nothing bigger that we have tried to accomplish in this state than this. It will change the way the Medicaid program works, but frankly, it's going to change the way health is delivered to North Carolina citizens. If you see something that can make it better, you need to raise your hand. If you see an idea that you think, well, maybe it doesn't work, right? Nobody knows or think that's a good idea, you need to raise your hand. But most importantly, if you see something that's gone off track, or you don't have the resources you need, or people aren't hearing you as you're saying that, or you see something that must be addressed, it's your responsibility to raise your hand. We all have to remember that, right? We have to make sure that we're asking the right questions, that we're communicating, and that when we need support and we need assistance, we're raising our hand. So I want everybody to raise their hand right now. So raise your hand. It's not hard, right? Not hard. But that's what we need to do as we're going through this project, to make sure we're willing to step up and say, I need help, or I can help somebody else, or I have a question that I need answered.
Good afternoon. My name is Shayla Arias, and I'm a North Carolinian, a member of our state workforce, taxpayer, and advocate, and a member of Mamás con Poder, Moms Rising. Most important, I am the proud mother of 2 children, Jasleen and Inak, who is 9 and 6. Your work touches our lives in profound and powerful ways. Let me tell you a little bit about me. I'm not just a mom, but a single mom. I'm a working mom and the mom of a child with a unique birth defects and special needs. Medicaid has made a huge difference for our family. Jasleen has needed a lot of care. She has serious medical issues from the time she was born. She needs specialties and surgeries and been on medication through her young life. Medicaid has been godsend. It has made all the difference in her and for our family. To give you just one example, in 2014, my daughter started the road of reconstructive surgeries. When you add up all the fees from the surgery, the specialties, the tests, the medication, the hospital stays, the therapies, the anesthesia, and more, the surgery costs come near $400,000. Those costs are completely unrealistic for working families like mine. Without Medicaid, she simply wouldn't have got the therapy she needed. But thanks to Medicaid, she got this vital care and can begin to tell you what a difference it has made in her speech, her hearing, and her mobility. But navigating the healthcare system with Medicaid, it isn't easy. I learned that many specialists put a limit on how many patients on Medicaid they will see a month because they are worried they won't get paid. That makes it really hard to find quality care, which adds to the stress in caring for a child with medical problems. For example, my daughter recently needed a second opinion on a kidney issue. We struggled to find a pediatrician nephrologist, and when we did find one, he didn't accept Medicaid. So we had to start searching all over again. This process is frustrating and exhausting. For people in Medicaid, it is not a choice of who we want to see, but rather who wants to see us. It doesn't have to be this way. We are all humans, and we struggle in life. We all want the best for our children and our families. I'm so thankful for the positive impact Medicaid has on my daughter and my family life. I don't want to think about where we would be without Medicaid. For parents like me, it's not that we don't work or that we don't want to pay, it's that we can. Families are terrified for their loved ones as they wait to be approved for Medicaid. For my family, it felt like an issue of life or death. If you're in a position where you don't have to worry about your health insurance, what doctors you will see, or how will you afford quality care, you are very lucky. No one should ever take that for granted. But please remember, the rest of us loving parents just like you, who want only the best of our children and families, too many of us are struggling day in and day out to get the care we need. So thank you again for the incredible work you do and give the North Carolinians access to health care. And thank you for allowing me to share my story today. I want to close by asking you to keep families like mine in mind as you do your work. As you discuss changes to Medicaid, think about my beautiful courage, Jasleen. Put yourself in her shoes and in my shoes. If you were in my situation, how would you want it to be treated? How can we, as a state, make sure every child and every family receives the care they need with the dignity they deserve? Medicaid has truly been a blessing for my family. I hope you will continue to improve this program so many more North Carolina families can say the same. Thank you.
Your department is often said it's the toughest job in state government. It's the largest department. It is complicated. You guys already know that. But you're about to embark on probably the most significant step that the department has taken maybe 40 years or so. And that is Medicaid transformation into managed care. Now, what we need to make sure is that the reform that we make helps people become healthier. What we have to do is do what no other state has done. What we have to do is to use this situation to make sure that we emphasize prevention and primary care and create healthy opportunities for people that Medicaid funds can help us do. I think being in the business, you all have a vision about how this ought to work. And although we have trepidation about entering into this new phase, and it's going to be a complicated change, I think all of you may be a little excited to think about the possibilities of how we can force things down to the prevention and primary care area and away from our emergency rooms where people are getting the most expensive care. And hopefully, at the end of the day, people will be healthier. I think that we can succeed. Know that your governor is grateful for your service. So many of you don't have to be public employees or state or local employees. You could be making more money in the private sector, but you have chosen public service. I want to thank you for that. And I want you to know that your governor has your back.
So I know Secretary Cohn, she will not sleep easy until people in the state are getting what they deserve. You all need to inherit that. You all need, many of you I know do, but all of you who are new to this needs to be very personal to you. Now, the Secretary brought in people here to tell you their story, and I think you should make that a habit, and to understand what it is like to participate in the system. I've been reasonably close to following what's been going on in this state, and I will tell you, it is not North Carolina's goal just to transition to managed care. It is North Carolina's goal to create the best program in the country with some of the most innovative thinking, some of the most leading capabilities, some of the most thoughtful work, and that's been going on. So here's what I would tell you. Go home tonight, tell your spouse or your friend or your kids that you are involved in the most exciting project in the state. Tell them that you are about to be a part of something that is going to dramatically make a difference in people's lives and in the state. Because it's true. I could tell you, having interacted with many, many, many states, what you all do, if and when you pull it off, will put North Carolina first. And you will get to be a part of that. And that is a great privilege. And it's something you'll talk about the rest of your career.
I just want to say thank you. Thank you for all the work that you do for North Carolina. I think we have all the tools we need to get this done. We have experience, we have knowledge, we have fortitude, we have our values, and we have each other, right? And so I know that we're going to be successful, and that success does not mean perfection. Success will have bumps, but it means that we're all going to solve problems together as a team. And in that spirit, I'm going to just remind you of our takeaways, right? So we are here to improve the health of North Carolina, the entire state, through innovative, whole person-centered and well-coordinated system of care addresses the medical and the non-medical drivers of health. We know this is a big change, but you're the right people. This is the right moment for us to make this incredible leap and take advantage of this opportunity. But we're going to have to work differently, right? It can't be the way we've always been. It's going to be communicating more. It's that accountability, right, that we're talking about. And we need to continue to raise our hand, to ask questions, to surface those issues, give us those visibility to those bumps as soon as we can. And we have to work together as a team, and that means whether you're on the Medicaid team or you're in mental health and working hard and being a leader in that space, or you're on the procurement team or IT, right? No longer. I want us to be that one team. And on that note, do this for Shayla. Do this for North Carolina. Do this for us as a team. Go get them. Thank you.